Victoria asked me a question about if we don't have MDM and we don't have time, but we need to pick an risk level, minimal, low, moderate, high, or you can say straightforward, low, moderate, high. How do we pick our answers? Based off acute or chronic conditions, stuff like that. So I'm going to attempt to answer that question and show you some examples here. So if we're going to be using this chart, which is in the 2023 book on page 8, and we don't have an MDM and we don't have a time, and we're going to use these columns and its guidelines to pick out the correct answer. If we're minimal or straightforward, the doctor would have seen you today and told you to go home and rest. Simple as that. That would have been his intervention. One other thing he might have said, or she, we've all heard it, go home and gargle with some warm salt water for that sore throat. What about an ACE bandage? Go home, wrap it up, elevate it, keep it above heart level. That would have been the total of the visit's outcome. Or any type of superficial dressing like a steri strip or a Band-Aid. That would be a very straightforward and minimal visit. For our low level, we would do something maybe like over-the-counter meds after a patient had some sort of minor surgery. We wouldn't continue with any pain meds, but we would DC that, tell them to take Tylenol or Advil over the counter, as long as there's no mention of any complications with that minor surgery, and there would be no identified risk factors at all. Another example might be if we ordered PT or OT therapy for a patient. That's pretty low risk for the patient and the physician. Another example is if they were slightly dehydrated and you needed to order just a little IV fluids. As long as it was with no additives, no pain meds, no chemo, no anything other than just normal saline to give them some fluids, this would be of a low risk. I find that patients with maybe a small infection like a UTI with no other chronic conditions, they just have an acute, uncomplicated illness like that UTI, they just get a 7-day prescription. They are often in this low category. Alternately, if we're moderate, we're mostly dealing with management of chronic conditions. So if a patient has diabetes and they end up with UTI, that could be a moderate. Any kind of reconciliation of medications are included in moderate. Right here, any of your prescription drug management is considered moderate. Decisions regarding elective surgeries without any risk factors could be moderate. I've got an example of an open percutaneous or endoscopy with no risk factors, could be in the moderate risk range. One more area in moderate is our social determination. If we can't treat them appropriately with their chronic conditions, let's say they're homeless, they have a social determinant that is affecting the outcome of their health, then that could put them in a moderate risk level. One more moderate area that's important to know is if your patient comes in and they have all these symptoms and your doctor's like, well, I don't know what it could be, but let's go order some tests. And for example, we've got a patient here with a lump in the breast. She's also having irregular periods. We really don't know what's going on with her. We're going to order the ultrasounds, the diagnostic mammograms and things, and some blood work, and make sure she's not anemic and all this stuff. We don't have any real diagnosis yet, and we have an uncertain prognosis. Those are often and always coded in the moderate section. Our last one, high, is coming up, but I just wanted to remind you guys that I do free lessons Monday, Wednesday, Friday, Arizona time zone from 6:30 to 8:30, completely free on TikTok and streaming now on YouTube. So I hope to see you there. If you like this content, be sure and like, follow, share, all that good stuff. Give a thumbs up. Your key word here with your highs is this word severe exasperation. If you look at the moderate, it just says chronic illness with exasperation, but it doesn't have the word severe. If you see anything about severe in a practice question or any other question, the severes are always high. These people are either circling the drain and you have to intervene, or their health is going to end in a bad result by scheduling an immediate surgery, getting them in the hospital for some test or a cath. Something needs to happen, or you spent a whole lot of time with these people, over 54 minutes, to be able to bill for a high, and that's face-to-face direct contact with them. So if you don't have MDM and you don't have time, you got to look through the chart and see if you see any severe exasperation with these patients. You can also look for patients who are being treated with chemotherapy or IV drugs that are really super toxic and they need intense monitoring while they're being given, like chemotherapy. That would be a high one. Decisions for elective major surgeries with patients that do have risk factors like heart disease, diabetes, kidney disease, of course. Emergency decisions on emergency surgeries. Right now we're going to the OR. Super important. That might be very high. Decisions to hospitalize the patient. Absolutely. Some end-stage renal disease that's already had a transplant, stuff like that. Super high, weak patients that have a lot of comorbidities that are having to be juggled all at the same time are definitely your highs. Be sure to check out the bottom of page 9 and 10. It'll go through and tell you what acute, uncomplicated problems are, what the examples could be, that kind of thing, all the way through chronic illnesses and stuff. Knowing what is actually inside each one of these little categories will help you put them into that chart for their categories. They even have guidelines about minor surgeries, elective surgeries, and surgery risk factors. Lots of information here that can help you out. This is on page 11. Look for the words that have example, because they will give you examples of how things should be coded in here too. They're just sprinkled everywhere throughout these guidelines. Some more examples, more. As you find examples that can fit in certain situations, you can add them even here, included in that chart too. Writing this stuff in multiple places is super helpful. Writing this stuff in multiple places is super helpful. So not only having it in the chart, but having it near the codes really helps reinforce the learning. Then we can move on to some other fun stuff. But I hope this explanation of the chart on 8 and 9 about the differences between straightforward, minimal, low, moderate, and high, what kind of examples would go in there, was helpful for you, and I hope to see you in my live lessons.